Dr. Behnam, and I'm here with one of my patients that we did his hair transplant. Now we did two procedures on him. I covered the hairline, mid-scalp, as well as the crown area. And please subscribe to my channel for more updates for hair restorations. Please look down for me all the way. You can see how thick it is. That's actually very important. We covered all this area all the way to the crown. Now please look slightly to your left. Perfect. Then you can see we took the same pictures at the same angles, and look to your right as well. Wonderful, excellent. And please look up again one more time, and you can see that the hairline looks very natural and also frames his face really well. So the design is very important. Please turn around to your right, and excellent. And take your ear and put it to your left, and you can see how natural it covers and conceals his scalp, which is very important. This is just only 2 sessions. Now please turn around and look at the wall right behind you. This is the crown area, which is typically the most challenging and difficult. Please look up towards the ceiling. Excellent, perfect, looks great. Now please turn around and look this way, as well as take your ear and put it to your shoulder. Want to see how it covers it so well. And please turn around one more time and slightly look down for me. Again, the key is the right doctor, right, that is board certified, the right staff. I only perform 1 surgery a day, and my goal is to really dense it up as much as possible, creating a very natural and age-appropriate design that frames the face. Thanks so much.